Hi friends, today we are going to discuss one of the most important common topic, fatty liver. What is fatty liver? How we can manage fatty liver? And what are the available drugs that are used for the treatment of fatty liver? So let's start about fatty liver disease. Fatty liver also considered as the silent disease that generally affecting 1 in 3 individual. In today's session, what you need to know is that what is fatty liver, why it is rising in India, what are the complications, and what are the available treatment. The most important problem is this that fatty liver causes no symptoms in its early stage, and by the time symptoms appear, significant damage may already have occurred. So this is the most important problem with the fatty liver disease. So what is fatty liver? You can see on the screen there are two type of liver. On the left side there are healthy liver. On the right side there are fatty liver. You can see fatty liver are enlarged in size, yellowish in color. There are deposited fat on the surface due to which there are developing scars. On the other side, healthier liver are red in color. Surface is very smooth. Tissue seems very healthy, and that's why its function remain efficient. But in case of fatty liver, liver become enlarged in size as well as its function reduced. So what are the important function of liver? The most important function of liver is that detoxification, digestion. Apart from these two, coagulation or play an important role in the clotting of blood. It support digestion, it store vitamins and minerals. But once it become damaged, once the liver become fatty, its function become deteriorated. Consequently, as the metabolism function become declining of liver, the toxin inside the body develops. Synthesis of protein become decreases. Nutrient storage capacity become deteriorated. Apart from this, chances of liver disease become higher. What is fatty liver? When more than 5% of liver become filled with the fat, we can consider this as fatty liver disease. In technical term, we can call this MASLD, metabolic associated steatotic liver disease, or metabolic dysfunction associated steatohepatitis. It is progressive inflammatory form of fatty liver disease. It is generally occurred due to the obesity, due to the dyslipidemia, due to the hypertension as well as diabetes. The most common myth is that fatty liver occur only in case of alcoholic person, but this is completely wrong. In recent survey, it is find out that millions of non-drinkers, non-alcoholic, develop it fatty liver due to its poor lifestyle as well as diet. Why India is facing a fatty liver epidemic? Simple. Because of its poor diet, because of processed food, sugary beverages, fast food. As you know, fast food become a normal nowadays. Apart from this, sedentary lifestyle means long sitting hours due to hard working, lack of physical activity, poor sleep pattern. All these contribute metabolic dysfunction. Apart from this, diabetes and obesity that generally seen in lot of Indians directly accelerated fatty liver progression. What are the symptoms and disease progression? You can classify or divide it fatty liver into 5 stages. First stage is first stage is simple fatty liver, in which fat accumulate but it can be reversible. Second stage, in which inflammation of liver cell occur, it can also be reversed. And this stage called as MASH, metabolic dysfunction associated steatohepatitis. On third stage, there are scar tissue develop on the liver, also called as fibrosis. This can be partially reversible. But at stage 4, that is totally reversible, and that called as cirrhosis of liver, in which permanent liver damage occur. And after the stage 4, there are advanced liver disease that is called liver failure, liver cancer. And the only treatment is the liver transplant. What research says about Indians? As per recent research conducted by Novo Nordisk company, around one third of Indians may have fatty liver disease, and this making it one of the fastest growing liver disorder in the country. There are some medical options available for the management of fatty liver disease, but lifestyle changes remain the first line treatment. Means even today, the most effective treatment for the management of fatty liver are lifestyle modification. For many patients, these measures alone can significantly improve or reverse early fatty liver disease. If you lost 7 to 10% of body weight, you can easily reverse your stage 2 fatty liver disease. What are the existing medicines and what are the big breakthrough for the management of fatty liver? Currently available medicine is pioglitazone that are generally used for the treatment of type 2 diabetes, saroglitazole that are generally used for the diabetes associated with the fatty liver because it's significantly used to reverse fatty liver disorder. Apart from these two, vitamin E, only for the non-diabetic patient, can also used for the treatment of or management of fatty liver because of its antioxidant nature. And apart from all these, there are a recent drug that launched for the treatment of obesity, that is semaglutide or GLP-1 agonist drug. Last year, this drug launched for the treatment of diabetes associated with the obesity, but it is find out that this drug can also significant reduction of fatty liver stages. So now Novo Nordisk company launches this drug semaglutide for the treatment of fatty liver. Apart from these drugs, there are one drug Rezdiffra that are mainly used for the treatment of fatty liver, but this is not yet approved in India. This drug approved in US only in 2024 specifically for liver fibrosis. It improves fibrosis and lower cholesterol. What are the India's new approved treatment? I have already told you Wegovy, semaglutide drug. How it works? It is GLP-1 receptor agonistic class drug. It reduces body weight and significantly reverses fatty liver. It is generally approved for the adult with metabolic dysfunction associated steatotype hepatitis and moderate to advanced liver disease. From the clinical evidence, it has been found out that it promotes significant weight loss, it reduces liver disease, and one of the most important thing, it that this approval mark a major milestone in the treatment of advanced fatty liver disease in India. Apart from these, I have already told you about vitamin E. Because of its antioxidant effect, it generally used to manage fatty liver disease, particularly in non-diabetic patients. It can reduce liver fat and inflammation, but it requires careful supervision careful supervision due to its potential side effect at higher dose. Vitamin E is generally used as off-label for fatty liver disease, but it is not considered as universal solution. What should you do know? As I have already told you that fatty liver become a very common, serious, but largely preventable and treatable disease. Please don't ignore these risk factors. If someone are obese or suffering from obesity, diabetes, high cholesterol, and hypertension, it increase your risk of developing fatty liver. So I would like to suggest you always screen regularly. Always go for medical health checkup regularly about the liver enzyme level and for the ultrasonography, and if possible go for the fibrosis scan. And one thing I also want to suggest you, if you start your healthy lifestyle, like if you start brisk walking 150 minutes a week, and if you lose your weight, maintain healthy diet, you can also manage fatty liver easily, or you can also avoid fatty liver disease easily. So all these are the about fatty liver disorder, fatty liver disease. I hope after this video you can know what are the fatty liver and how we can avoid this metabolic disorder. Okay, bye.